In general, in Amarillo, there's a huge psychiatric need in the community. The bread and butter kind of things that we see in our clinic are depression, anxiety, bipolar disorder, and more broadly in the community, of course, we have some of our more serious and persistent mental illness like schizophrenia, and substance use is everywhere. So alcohol, in Amarillo in particular, methamphetamine use. We do have an opioid problem here as well.
3 out of 4 people are interacting with mental illness or addiction at some point in their life. If not themselves, a family member, a friend, a colleague, someone they know, someone they've done a project with. That's a lot of people. I've suffered with depression myself.
Understand the prevalence of people who are having difficult times, stress-related issues, depression, anxiety. Realize that you probably know someone who's struggling right now or dealing with it and just coping somehow on a day-to-day basis.
Going into the pandemic, we were doing a terrible job with mental health, particularly the mental health of young Americans and young Texans. So before the pandemic, suicide was the second leading cause of death among adolescents and young adults up until you get into your 30s. So now, 2 years in, we have baseline rates of depression in the country more than 3 times what they were before the pandemic. And we don't know, those aren't necessarily severe cases of depression, but it's 3 times what the baseline was. We think a lot of it's mild to moderate, but it increases everybody's stress. Rates of anxiety disorders, not just, a little bit of worry. I mean, to worry about a pandemic is a normal reaction, but to worry so much that it interferes with your daily functioning. And I think, nowhere clearer than in our emergency rooms, our children's hospitals, where we've seen a 50% increase in the number of young people coming in at risk of dying from suicide, particularly girls and young women, but really across the board. Not just ideation, but like mortality was at the highest rates ever.
With our students, lots of times when they come in, it's because of suicidal thoughts, feeling helpless, feeling hopeless, feeling like they might have made a mistake. Maybe they shouldn't be in college. Maybe they're not prepared for college. So we're just seeing a lot more students, and it's a little different kind of student. We've seen more students that are typically those who do well academically, manage stress, can take on a lot. And it seems like people are very much struggling more than they did before. And we're looking at about a 60 to 65% increase in the number of people since 2016.
People who had previously been fairly stable in terms of existing mental illness, anxiety, or depression had exacerbations. All across the board, all across the country, we've seen increases in substance use disorders and overdose deaths with every single substance.
I think the pandemic has opened it up to where more people are experiencing behavioral health issues. Because their life changed, and it changed without anything that they had control over, right? And so we were all exposed to that, and we all became vulnerable together in different ways. But I think it kind of leveled the playing field for some folks, where maybe they didn't really think about their mental health or behavioral health issues, and then all of a sudden when their life changed, things started happening differently. Their security got rattled.
The average time between the onset of symptoms for a diagnosable psychiatric condition and date of treatment is about 10 years. It's longer for folks with a substance use disorder mixed in with that. So if folks were on the edge before they were told to isolate, they lost housing, they lost jobs, they lost family members, huge stressors come into their lives, it's going to be a minute before we know like the full impact of that. And we know that it's relapse rates have gone up. We know that it's been really, really, really hard on lots of people. It's going to be a while before we really fully understand the impact.